Hi, I'm Sam. I live in Watford. I'm an NHS dental patient, and I've got a new dentist at my practice. I've only seen him a couple of times, and I just want to know a bit more about what I should expect.
Hi, so I'm very pleased to meet you. My name is Shazad. I am a general dental practitioner working within mainly the NHS around Greater Manchester, and happy to help you today with any questions. I have a keen interest in gum disease and how to manage gum disease, and I've been doing quite a bit of work around Greater Manchester to support practices with that. How can I help? What questions can I answer for you today?
Or when I go and see my dentist, am I expecting him to check my teeth for cavities only, or is he really meant to do a bit more and look more at my gums?
So when you go to the dentist, we do more than just checking for cavities in the mouth. We actually do a full examination of the mouth. So we start with going through your medical history and your medical records, because sometimes some of the medical conditions can impact on what's happening in your oral cavity, as well as sometimes we need to be careful when we're doing some treatments. So usually they start with a medical history, and then they will go on to examine the outside of your mouth and your facial profile, look at your jaw joints, and then look inside your mouth and look at some of the soft tissues in there, your tongue, your cheeks, and check for any lumps or bumps or patches. We then go on and check your teeth for any cavities, but after that we also check your gums, because gum health is very important. So we look for signs of gum disease, and we're screening for gum disease as well. So as a part of that checkup, after checking the teeth, the dentist will use a blunt probe to gently stroke around the gums and really looking for signs of bleeding, because healthy gums don't bleed. And so bleeding is important, and we want to try and eliminate that, as well as calculus buildup or tartar buildup around the teeth. And then we also look for signs of more serious gum disease and more deep pockets around the gums using that blunt probe.
And do hygienists still exist? Because I haven't seen one for ages.
So the dental team is wide and diverse, and we have hygienists and dental therapists that also are in practice who support the dental team in delivering care and certain aspects of care.
And is it down to the dentist to suggest that I see the hygienist, or are you saying that the dentist himself or herself actually has taken over that work?
So depending upon your practice and how the makeup of that practice is, sometimes you'll have the dentist who will then refer to the dental hygienist or the dental therapist and ask them to do some of the treatment that you'll need around gum treatment. Or sometimes you can access a hygienist or therapist directly as well.
Right. And at the moment, I'm on universal credit. If I went to a hygienist, would I have to pay for that? Do you know?
So if the hygienist is working within the NHS, under an NHS practice, then you wouldn't have to pay for that, because you'll be exempt for dental treatment. There are certain people who don't have to pay for dental treatment. So for example, if you're on an income support or pension credit guarantee, or you hold certain certificates like a HC2 certificate or a maternity exemption certificate, then you won't have to pay for your NHS dental care. So if that hygienist is working within the NHS, then you wouldn't have to pay. But if they're working independently or privately, then they would have their private fees that you might need to pay for.
And if I develop something like periodontitis, is it? What treatment is there for that, and would I have to pay for it?
So what you've mentioned there is periodontitis, which is the more serious and destructive form of gum disease. So there's two main types of gum disease that we have. The first one is gingivitis, which is inflammation of the gums and bleeding gums.
Yeah,
and this is very important, because unless we eliminate that inflammation, as time goes on, that inflammation builds up, and at a certain threshold, our body then starts to react to that inflammation and starts to destroy the ligament and bone that surrounds the teeth. And that's when it moves to periodontitis.
Okay.
So once you have got periodontitis, you are a periodontitis patient for life. Now, that's not the end of the world.
Sounds scary.
It does sound scary, but it's not the end of the world. We can very successfully treat and manage periodontitis very well. So we have our new treatment guidelines at the moment, the S3 guidelines that have been recently released, and they talk about using a stepwise approach to managing the disease. And the first step of care is to educate yourself on how you can clean your teeth above the gum properly. Because unless you can remove the dental plaque from above the gum, then we don't have much chance of removing it below the gum and trying to stabilize the disease. So the first step of care is really all about how to clean your teeth. And it's important to note that whereas a normal person who doesn't have gum disease might, for example, brush 2 minutes twice a day, a person with periodontitis, it's going to take them longer to clean their teeth. They've got more areas to clean and also longer teeth maybe, and some difficult areas as well. So that time will take a bit longer. And your dental team will help to talk you through a personalized plan of how to brush your teeth, what to use, a manual toothbrush or electric toothbrush, and how to clean, especially in between the teeth, because this is one of the areas that's neglected very often. And so what interdental aids or brushes you need to use, what sizes you need to use, and any other aids such as, single tufted brushes we have. So they will look in your mouth, they will examine if you have periodontitis, they will formulate that personalized self-care plan for you and talk about how to go about managing the plaque above the gums.
I've tried dental brushes before, but I don't really get on well with them. I think my teeth are too close together, because if they're thin enough to go in between my teeth, they just bend. So I tend to try and remember to use dental floss.
So that's correct. If you're using the smaller size brush and it doesn't fit, then instead of using the interdental brush, you can use the dental floss in those tight gaps. So for periodontitis patients, we recommend interdental brushes. So where you can use an interdental brush, it's important you use the right sized brush in that gap. Because if you're using too small a brush in a big gap, it's not doing its job.
Right.
And if you're putting in the effort, we want it to be producing results and being effective. So it's important that we're using the right size brushes in the spaces. And your dental team will help to map out your mouth and what sizes you use. So remember, one size doesn't fit all. So you might need 2 or 3, maybe 4 different sizes of interdental brushes to cover them out.
Yeah, I think my mum's got a couple, a blue one, or not one, obviously, use them.
So the colours are also, different brands have different colours, but it's important just to look at the ISO readings on the interdental brushes, because that's a standardized size, because sometimes a blue color in one brand might be a different size in a blue color in a different brand. So just watch out for the ISO labels where it tells you the size of the interdental brush in millimeters.
So they're saying they're different brands, they're different qualities as well?
Different brands have different qualities. Some are more environmentally friendly, some are still using some plastics, and there's a wide variety available to you. And again, your dental team will help talk you through the various brands and what they prefer or what you prefer, and it's really what you get on with best. You might find a particular brand or type of brush is easier for you to use and is better when you're handling it and using it.
No, I think I'll have another try then, because I gave up quite quickly. So yeah, it's worth persevering and anyway carry on using my dental floss.
So once we've delivered the first step of care and given you that personalized self-care plan and taught you how to remove the plaque from above the gum and also identified any risk factors, the main ones being smoking and diabetes.
Don't smoke.
We will then, which is good, we will then go on and we'll reassess you. And we're going to really assess of how you've done with your cleaning. Because as I said earlier, if we're going to try and eliminate bacteria from below the gum, we need to get the cleaning above the gum right. So the dental team will re-examine you and reassess on how you've done with your plaque control. And from then, they will then decide to move on to the next step of care, which is then the professional cleaning below the gum. So the dental team will do some meticulous deep cleaning below the gum to remove the plaque from below the gum. And this will then take place. And sometimes that might need some local anesthetic, so you might need some, to numb your gums to have that treatment done.
Oh, just an injection?
It's just an injection.
Right, yeah.
It makes it more comfortable for yourself and it allows us to do our job more thoroughly. So overall, I know patients don't like to have injections, but sometimes we give the injections to make it a more comfortable experience overall.
I find it much better, because if I'm anticipating pain, then I'll tense up.
Yeah.
But if I've had the tiny bit of having a jab, then I'll relax and won't worry about what's going on.
Which is why we give it, to make it more comfortable with yourself, and so we can deliver that treatment thoroughly and properly. So once we've done that, we'll then reassess you again, and hopefully we'll see some improvement in those deep pockets and them reducing in size. However, if we are still done that maybe a couple of times, then we might decide, if the treatment is not responding, to then refer you to maybe a dentist with a special interest in gum disease or a specialist in periodontology. And that then might require some further treatment or even in some cases some surgery on the gums.
What kind of surgery?
So this is gum surgery where either they aim to reduce those deep pockets so you can clean the teeth above the gum properly, because those deep pockets are difficult to access for yourself and clean thoroughly. So the gum surgery is really aimed at either reducing the depth of the pocket, or sometimes we try and regenerate some of the bone that's been lost in specific cases where it's suitable to do so.
And would you recommend mouthwash? Because I use that. In fact, I use that more than I remember to use dental floss.
So adjuncts are useful to help you with your plaque control, but they don't take away from the gold standard. So the gold standard is about brushing twice a day and your interdental cleaning and your personalized self-care plan. Your adjuncts, and that's why they're called adjuncts, are there to help you alongside the gold standard. So your base.
And if you eat a lot of garlic.
And if you eat a lot of garlic, it will help you with your breath as well. That is also true. Finally, once we've delivered the treatment, we aim to get you to stability, the final step of care, which we call step 4. That's called maintenance or supportive periodontal care. And it's important to realize that the supportive periodontal care journey is a journey for life. Because once you have periodontitis for life. Very much like if you have diabetes, you have it for life.
But if you follow these 4 steps, it can be, the progression won't carry on.
Exactly, and that's why it is a supportive program, because we've got you to stability now, meaning we've eliminated all the disease and we've stabilized the disease to prevent it from advancing further.
Right.
But it's important that we continue to monitor that carefully to make sure you don't have any relapse or recurrence of disease. Because we're all human beings, we go through ups and downs in life, and sometimes we might be cleaning really well, but then we have some difficult periods and life takes over, stress takes over. But we're here to support you to make sure you get back up to where you need to be so we don't have any recurrent disease and you remain stable. So that recall period can be anywhere between 3 to 12 months, depending upon your risk profile and what the dental team has decides that you need as a recall and a maintenance program. But it's important that you recognize that that is a supportive care program, a maintenance program for life.
Right. So where can I go to read up? Because that's a lot of information you've given me and I haven't got much of a memory.
So the BSP has some excellent resources on their website. They have a very nice patient information leaflet, and they have a number of sections on the website explaining all about gum disease, the links to other diseases, systemic diseases such as diabetes, cardiovascular disease, and smoking. But they also have the new treatment guidelines, which have been produced also for a patient. So it's a nice simplified version of what I've explained today about that stepwise process of how we approach treatment of periodontitis within practice. So you can have a look at the BSP website, and the resources are all there. www.bsperio.org.uk.
Thank you very much. It's been really informative and helpful.
Thank you very much. Nice to meet you.